What is trauma? According to the Substance Abuse and Mental Health Service Administration's Trauma and Justice Strategic Initiative, trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally threatening, and that has lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. Some people experience a traumatic event at a young age or in adulthood. According to Bessel van der Kolk in his book The Body Keeps the Score, the brain responds to a traumatic event automatically by one of three mechanisms: fight, flight, or freeze. Intense emotions activate the limbic system in the lower part of the brain, or emotional brain, in particular, an area located in it called the amygdala. The amygdala warns us of impending danger and activates the body's stress response by increasing adrenaline and cortisol. Activation of this fear center triggers the cascade of stress hormones and nerve impulses that cause an increase in heart rate, respirations, and blood pressure, which prepare the body for fight or flight. Another possible response to a traumatic threat is freeze, in which the body registers the threat, but the conscious mind ignores the messages. The person may feel numb or feel their emotions detached from their thoughts, behavior, and memories. Sibyl talks about events in adulthood that led to trauma responses. She was just released from a correctional institution.
I got out the Monday program, wasn't out 30 days. And I wanted to be around my brother. And we went around where they were getting high at. And so my mother came and she said, "Sibyl, come home because your brother stole your dad's gun and something's going to happen." And I was like, "No, I'm not coming home because I wanted to be with my brother because he had just got out the penitentiary. And I wanted to be with him." And so that night, he got into a fight with somebody, and he was in the basement. And so when I came down there, I had his gun, and he asked me to pass him the gun. And so as I was passing him the gun, everybody was grabbing my hand, and so my hand hit the back of the guy's head, and his body just fell to the floor. And I just started screaming, and my brother told me to shut up, to stop screaming. You know, I don't know if he's seen that before, but I haven't. I had only seen it on TV. And then it happened because of me, because the gun was in my hand. And that was very, very scary and traumatic for me, because I knew that he had a family, and it was like, by me being in that life, you live by the sword, you die by the sword, and that's how I felt like I was going to die, by someone shooting me and killing me. And so I got real paranoid after that. I didn't like to be around a lot of people. I was real depressed. I would get anxiety. I would hear voices telling me that I was a bad person and all that. And I would just see, the body on, falling to the floor. I went and seek help, some outside help at Daymont West to help me cope with that.
The prevalence of trauma among mental health clients is high. More than 84% of adult mental health clients have trauma histories. 50% of female and 25% of male clients have experienced sexual assault in adulthood. Often, the content of their hallucinations and delusions is based on the client's memories of past trauma. These clients have earlier first admissions and more frequent and longer hospital stays. They spend more time in seclusion or restraint and have a greater likelihood of self-injury or suicide attempts. Their symptoms of distress are more severe and they use more medications. There is clearly a correlation between trauma and substance abuse. Substances such as alcohol, barbiturates, cocaine, and opioids are frequently abused in an effort to relieve or numb emotional pain or to forget the traumatic event.
But it felt like if I did drugs, that would take away me remembering that. So I continued to use to cover that up. Another traumatic thing that has happened to me is that I was in a car accident. I had 5 years clean. I had just got out the penitentiary, doing a 2.5-year bid in 96 and 98. You know, I had got my life back together. I was going to work, doing what normal people do. I bought me a new car, but I wanted to still be with the people in the lifestyle.
Emotional reactions to trauma can vary greatly and are significantly influenced by the individual's sociocultural history. Most trauma survivors are resilient and develop appropriate coping strategies and recover with time. Only a small percentage of clients with a history of trauma show impairment and symptoms that meet criteria for trauma-related stress disorders, including mood and anxiety disorders. Some adaptive behavior to trauma may be interpreted by the mental health system as symptoms. Disrupted self-soothing may appear like agitation. Disrupted ability to see the world as a safe place may look like paranoia. Distrust of others can be interpreted as paranoia even when it's based on experience. Disruptions in organized thinking in order to make decisions may appear like psychosis.
I've been through a lot as far as getting beat, raped, strangled. And from the strangulation, it's like I'm scared for when people come close to my neck, I get a little nervous, you know. Like my significant other, if she, come from, I always push her back because I think she's gonna strangle me. But I know that I'm not getting strangled, but it's just a reaction from what happened to me. I was scared to drive on the highway. It took me years to drive on the highway after the accident.
A trauma-informed approach moves away from asking a client, "What's wrong with you?" to asking instead, "What happened to you?" A trauma-informed approach realizes what happened may impact the traumatized individual's ability to cope and function. Trauma can negatively impact a person's ability to form trusting relationships, so safety in the healing relationship is of primary importance. Resilience and recovery helps the individual understand the biology of traumatic stress reactions and learn skills to return the body, mind, and spirit back to balance after experiencing traumatic events.
I'm working a program today that helps me deal with the stuff that didn't happen to me in the past because I just couldn't stop thinking that about the omen piece with me, You couldn't tell me that I wasn't the devil. You couldn't tell me. And until I started working with a sponsor, it was one simple thing she said. She said, "You're not God." And I couldn't understand that all the other times that I wasn't God. And if it was their time to go, it was their time to go. But it was like, why with me? Because now I'm messed up from the things that happened. I can't sleep at night. I have to take medication, to deal with the voices, the insomnia, and all that because of the wreckage of my past. Sometimes even when I look at a scar on my body, I can go back and I can remember like it was yesterday. like on my arm. You know what I'm saying? It's like I can still feel when he put that iron on my arm. I can look at my hand and remember when he cut me, you know, like it was just yesterday, you know. And it's like now I'm talking about my stomach is, you know, getting kind of, you know, turning and flipping and stuff. Like it was like yesterday. When I get to thinking about the things that I've done and stuff, it's like I just want to give up on my life, you know. But today, with Narcotics Anonymous, you know, I can be me. I can be me. People don't judge me for my past because they have a past too, you know. It's somebody just like me in there. So, you know, I feel comfortable in Narcotics Anonymous. For people with trauma can overcome those things if they go through the right channels and the proper channels. And basically that's what I done because that's how I got 10 years today.